Hello and welcome to OffBlueMedical. Today we will discuss 10 more quick notes for the USMLE, and this is going to be episode 2. So the first note, which is very high yield, you have to know that eating undercooked shellfish is associated with 3 pathogens which are very important. They are Vibrio vulnificus and Norwalk and hepatitis A. So when a question mentions shellfish, undercooked shellfish to be exact, then you would have to remember 3: Vibrio, Norwalk, and hepatitis A. So you have to remember these. The second note is that malignancies with propensity for bony metastasis is the mnemonic for that is lead kettle. So lead is PB, which is the chemical name, PB, the chemical abbreviation, PB, which is lead, and kettle, KTL, so PB, KTL, that is prostate, breast, kidney, thyroid, lung. So all of these have a propensity for bony metastasis, so they can go to the bone, which is lead kettle, prostate, breast, kidney, thyroid, lung. The other note is drugs increasing lithium toxicity. So lithium is given for bipolar disease, and the drugs that increase its toxicity include thiazides, NSAIDs, ACE inhibitors, tetracycline, and metronidazole. Among the second generation antipsychotics, you have to know that ziprasidone is most often noted for causing a prolonged QT interval. Of course, all of the ones that are ending in "don" are associated with a prolonged QT interval, but specifically, ziprasidone is very important and high yield. That is a drug that causes a prolonged QT interval. You have to also know that cytochrome oxidase inducers such as phenytoin, phenobarbital, carbamazepine, and rifampin, you have to memorize these. They increase azole drugs metabolism, thereby they lower azole concentration in serum. For example, ketoconazole, they lower its concentration in the serum if you take phenobarbital for, let's say, epilepsy. Another very high yield note is that common findings in acute graft versus host disease include 3 findings which are very important. That is rash, diarrhea, and changes in liver tests, which is elevations in AST and ALT. So this most commonly occurs with bone marrow transplants, and you're going to see rash, diarrhea, and you will see also liver disease, elevations in AST and ALT. In biliary atresia, which occurs in babies, so you're going to see an increased level. You're going to see an increased level of direct bilirubin. You're going to see an increased level of direct bilirubin in biliary atresia. In its histology, what are you going to see? You're going to see inflammation and proliferation of small bile ducts. So the extrahepatic biliary tree is removed. That's going to lead to inflammation of the intrahepatic small bile ducts. And for the USMLE step 2 CK as well, they might bring up a child who has an increased direct bilirubin level. Then what are you going to do next is that you're going to do an abdominal ultrasonography. And how can we confirm it? Is with liver biopsy. We have a syndrome called Leriche syndrome. This is occlusion of the aortoiliac artery by an athyroma, leading to a triad, which is going to be bilateral. Okay, so it's not unilateral, it's bilateral. Hip, thigh, and buttock claudication. Absent pulses with symmetric atrophy and erectile dysfunction. So all of these. So they affect the legs and down. So if I were to draw this, if this was a human, okay, at around this level, the aorta is going to bifurcate, and if there is an occlusion here, then it's down below, actually, not at this level, but this is just for explanation. So if it was down below, let's say it's right here, because the aorta is going to bifurcate here into the iliacs, okay, and if it was here, then that would be causing bilateral hip pain, claudication, thigh claudication, buttock claudication. You're going to see absent pulses, and also, since that's going to go to the genitals, you're going to see erectile dysfunction. You have to also know that drugs that cause a nephrogenic diabetes insipidus, that means it doesn't respond to vasopressin, they include lithium, which is very important, amphotericin B, also very high yield, and gentamicin and cisplatin. So lithium and amphotericin are very high yield. Gentamicin and cisplatin are also important but less high yield. The last note says that hypothyroidism can have increased CK levels. So if you see increased CK levels in the patient, in any patient, maybe sometimes they are even asymptomatic. So you have to know that creatine kinase can be increased in hypothyroidism. So what are we going to do here? We're going to screen for hypothyroidism via a serum TSH check.